In Ondo State, a new government initiative to deploy tricycle ambulances across rural communities has sparked mixed reactions among Nigerians. The state government says the project aims to improve emergency healthcare access in hard-to-reach areas where regular ambulances struggle to operate due to poor road conditions. Officials describe the innovation as practical and people-centered solution. But the move has ignited public debate, with critics questioning whether tricycles, popularly known as keke, can truly meet the demands of modern medical emergencies, especially after the recent deadly attack in Ondo, which exposed the urgent need for rapid response and well-equipped emergency services.
Many residents and health experts say the idea, though creative, may not address the deeper issues of healthcare infrastructure, emergency preparedness and security coordination, particularly in a state still reeling from the trauma of the attacks. Others, however, argue that in rural communities where ambulances can't access remote roads, any functional emergency transport is better than none, provided they are properly equipped and staffed. To help us unpack the mixed reactions to this initiative and what it means for healthcare delivery and public safety in the wake of recent events, we're joined by Senior Special Assistant Governor of Ondo State of Strategic Communication. We have Mr. Sowore, who joins us this morning. Good morning.
Good morning. Thank you for having me.
Thank you. What exactly is the Tricycle Ambulance Initiative? And what problem is the Ondo State government trying to solve with it, even though there are mixed reactions coming from various quarters, wondering what a tricycle will be doing, especially with the current situation in the state?
Thank you. Thank you for this question, and thank you for the opportunity to actually let the people know what we are doing. In Ondo State, there are 18 local governments. We have 203 wards. We have communities that are practically inaccessible through roads because of the difficult terrain. And as a matter of fact, we have 2 local government areas in Ondo State that are on the riverine. So, as you know, health institutions are categorized into 3. We have the tertiary health institution, those are the teaching hospital, or referral hospital, as it may be called in the medical language. Then we have the secondary, which are comprehensive health center. These are located in the headquarters of the 18 local government. Then we have primary health care or health centers. These are located in almost in each of the local governments within the state. So last year, the state government launched emergency and ambulance services that, buses, what you are used to. In the cities, in the towns, where there are roads and there are accessible roads to the hospital. So, but the people who are in the interior, they don't have access to some of these things, they don't have roads. So we cannot, construct all the roads in the state in the same day. So in a way to ensure that those who are in the interior equally have access to this emergency, the state government decided to launch Tricycle ambulance for these villages. In fact, I will send you the picture. We equally have both ambulances for the 2 local governments on the riverine. So basically, is to let the people know that even if you live in the village, that government cares about you, and you can have access to some form of mobility when you are in need of emergency health care. And we are creating that awareness so that people in the village get to know about the availability of these tricycle ambulances. It's basically to assist the people. Everybody cannot live in the city, as a matter of fact. Everybody cannot live in Akure, Ondo, Ikare, Oktikpa. There are farmers who are right there doing their farm in the village. But government cares about them. And we are letting them to know that, look, wherever you live, wherever you may be, that there's something for you when you are in need of emergency help. That's exactly what the government has done.
And there are those who would argue that it speaks to inclusion, so that those in the rural communities are not excluded in certain medical services, right, and with emergencies. And you also spoke about the state having standard ambulances. Part of the concern is that these tricycles will not have standard equipment. So what would you say in terms of equipping is the difference between these tricycle ambulances and the regular ones? To what extent are they equipped?
As you know that even those, just like I said earlier, those health centers are not necessarily to take care of serious medical condition. They are just what is called first aid. If a woman that is pregnant needs to move to a health center, maybe for her regular visit during the pregnancy in the village, she can use this one. But when she's needs serious medication or medical attention, as a matter of fact, you know that she will be moved to the city where you have standard medical facilities. So it's a collaboration, it's a collaborative effort between the primary healthcare, the secondary healthcare, and the teaching hospital that we have. Basically, for instance, if for instance you live in Okitukupa or Irele, there are interior towns and villages where this can take you to the city. The moment you get to the city, like the government headquarters, you have access to the best ambulances that you have access. So this merely first aid. It's first aid to take you to the nearest medical center. But immediately you are there, you get there maybe from your village. If your medical condition cannot be solved, immediately the standard ambulance arrives. It's a collaboration. It's a collaborative effort between the interior, the towns, the periphery, and the cities.
My colleague said that you talking about the practicality of this, the ambulance. You look at a picture of the ambulance and you're wondering where ventilation what manner of ventilation do you have in those tricycles that the heat might even kill a patient before he gets to the hospital. There are also critics of Ondo State's government that say Ondo is an oil-producing state, and this initiative is shortchanging the people of Ondo State. That when you say there are certain areas that are not accessible, why not fix the roads that lead to those areas and buy standard ambulances that for an oil-producing state, the people of Ondo State deserve more? How do you respond to that?
Yes, I tell you that you cannot consult all the roads. As I speak to you, I am in my own town, Kuribo, in SL, the local government. And I can tell you that if this government want to construct all the necessary roads to access Akure from where I'm speaking to you, perhaps it will take the next 2-3 years. Because as I speak to you, I am on the River Rhine. So we may need to construct bridges, like 2 or 3 bridges. And we have 18 local governments. We have 203 wards. We have more than 1,000 communities. Ondo is not a city state like Lagos where all the people are in the same town. In one local government, for instance, in a larger local government, you will spend 4 hours on the waterways to to access the headquarters in Bokoda. So if you want to construct a road to some of those communities on the river line, even the federal government Lagos-Calabar Express cannot solve all our problems in the riverine community of Ondo State. So I'm saying that it is practically possible to construct all the roads within 1, 2, 3 years. It's a continuous exercise. But the people who need help, they need emergency. Right now, as we speak, there is somebody who is in need of help. Do you wait until you construct a road to that community before you assist that woman that is pregnant? Do you wait until you construct a road to the woman or a man who is working in his farm and accidentally he used cutlass to cut his leg before you attend to him? No. So this is the temporary measure to assist people who are in need of help before we construct all the roads as they are required. So, those days we don't take transportation easy, Don't forget those days perhaps the only state where the government takes students to school in the morning. I will return them back in the evening in a well-protected buses. Go and ask. In the whole of Southwest, I don't see any other state where government is responsible for the transportation of students in the morning, well protected, and we return them back to their parents in the evening. So the same thing we are replicating in the health sector, that everybody who is in need of health services is transported wherever you are. You are in the village, you are moved to the town. If your health condition improves, then you go back home. If it does not improve, then you enter a more well-equipped ambulance to take you to the city. So you from primary health to secondary, then to the tertiary, which is the teaching hospital.
It seems pretty much like a laudable initiative. Now that you've broken it down into bits and pieces, areas where there's a lot of lesser penetration in terms of entry, rural areas, so they can move them out, quickly administer maybe first aid and see if they can get themselves back up before they're now moved to a proper hospital, if we want to look at it that way based on your explanation. But my question is, how many of these do we have in Ondo State, and is it free? Because that's the most important question for every person who lives in Ondo. Is it free? Is there a toll-free line if they call? What's the plan? Who are those that would be riding on these bikes? Who would take charge of them? Is there an after maintenance service? I wouldn't say sales, because I don't think it's on sale. Or better still, is it put on sale? I mean, just give us the internal strategy for this.
Okay, thank you. Basically, we have 2 or 3 wards. So in each of these wards, there is a comprehensive health center. In each of these wards, where you have good road, you have ambulance, standard ambulance. And there is a telephone number, toll-free, that every person, particularly pregnant woman, can call when they are in need of this service, free. So, and the vehicle drives straight to the woman or the patient who will have earlier registered with this health institution to pick him or her up to the basic health center. So, this particular program is designed for pregnant women who may need to attend her regular when she can't get there herself. So every registered pregnant woman in Ondo State has that number toll-free to call at every particular point in time in her choosing basic health center where she has registered. So if the woman is busy, her husband is not available, and she needs health service, she just calls the number. and the vehicle will be right there because they are all registered. So 203 wards across the state, in the two local governments where you have rivers everywhere, there's ambulances, both ambulances that they can call. I get to the health center through the boat. So I'm not sure that the people who are circulating this have the pictures of our boat ambulances. So same thing applies to our free shuttle buses. We have shuttle boats that take students from home to school on the river. So it's free, completely free for all the registered people who patronize our health institutions.
What mechanism? Because we do have, sometimes we struggle with seeing that when there's a new initiative is being followed through and that the quality at the start remains the quality. So is there a quality control mechanism put in place to ensure that, you know, the standard operation of these ambulances, you know, is optimal and that it's not diverted for another use? We don't want to see that tomorrow somebody is using it to hawk their private business.
Fortunately, this is not even a new initiative. This particular program was started during Dr. Olusegun administration, and it is called the ABI. You know, ABI in Yoruba means that every child must survive. So this is just to boost that initiative. So already there is a standardized mechanism, and the people in the state are used to it. So nobody is going to divert it. In fact, there is the primary healthcare board where people can even report in case of any misuse or abuse of some of these. But I can tell you, we have not recorded much abuse. Even people from other states come to Ondo State to deliver baby because of our standardized test. Because, you know, as we speak, health is free for children from 0 to 5.
All right.
Okay.
0 to 5.
Yeah,
completely, absolutely free. Transportation.
My final question before we wrap this up here is there was an attack 2 days ago in Ondo State, in Sowore, where 6 worshippers were kidnapped. What's the current status with regards to those attacks? Is the police investigating? Have they been rescued? What's the current situation with that?
Thank you. In the late night of Tuesday, the traditional ruler of Usho community called the security services. There was an invasion of hoodlums and kidnappers in the Celestial Church of Christ in Usho community. Our security agents quickly moved to the scene. There were 12 people that were taken initially, and the security agents rescued 7. So I gave this kidnapper chase. They went away with 5. As we speak, all the security agencies in Ondo State are on their case. The forest is being combed, and all checkpoints the security is on record to ensure that these victims are rescued safely. And I can assure you that as soon as possible, because all security apparatus have been put on red alert to ensure they are safe rescue. God willing, they will be rescued safely by security agents because we have a well-coordinated security network in Ondo State, including the Amakekum Corps, which is the state own homegrown security network, helping with intelligence, and it has helped seriously. But we know this is our own share of the insecurity generally in the country, knowing full well that Ondo State share boundary with 7 states, share boundary with Kogi, Edo, Delta on the riverine, Lagos, Osun, Ogun, and the rest. Even some, Ondo State is the access, the closest to the southwest, the northeast, north central and the southeast, the 5 eastern state of Anambra through Benin access. So these are our share of the general security in the country. Very, very unfortunate, but government is doing everything possible to ensure that these victims are rescued alive.
We really don't. We hope that these people who have been kidnapped are rescued. We read that the governor has inducted 500 new Amotekun members. We want to see that there is an impact of this, and that we don't continue hearing stories about this, and so that citizens can feel safe in their state and in their country. Thank you for joining us this morning. But I think in 30 seconds, if you can, just to mention what would be a landmark, and this is going back to the tricycle ambulance, in 1 year, what would be a landmark for the government to decide that this project is a success? And if the government finds out that in 1 year it hasn't improved the state of healthcare in Ondo State, will it be terminated?
Yeah, healthcare has always been one of the cardinal program of even successive government, and this government is doing everything. If you come to Ondo State now, you acknowledge the fact that the government is doing much in terms of road infrastructure, and when you have dualized road across, this is the first time in the history of the state where you have dualization of roads across the 3 central districts. So government is doing everything possible to actually make Ondo State. Now he met it. Dr. Locke that you were, and those who I know about which was this friendly story. I can also say that the government is doing everything possible with Ondo State against pride. I just like to ask what would be the landmark. For us, the landmark or the objective is to make Ondo State a tourist center for the entire southwest, and we are working on it.
All right. Ondo State to be a tourist center for the entire southwest. We'll continue to follow up and maybe re-invite you again in another year to see the landmark of success for this project. Thank you so much for joining us, Mr. Sowore, this morning. We look forward to having you again.